So good morning, good afternoon, and good evening to you all, depending on where you are joining from. My name is Sylvester Moyo. I'm very delighted to be your host today. Today's topic, simplifying AMR surveillance, building expertise alongside automated AMR, AMC, and AMU analysis through Africa's Knowledge Hub. We will be diving into how technology, more specifically open source tools and strategic collaboration can transform the way we analyze and use AMR, AMC, and AMU data in Africa. Well, with the growing antimicrobial resistance threatening progress in public health, especially across low and middle income countries, there is a pressing need for us to move from passive data collection to proactive data collection, interpretation, and using this data for decision making. Today's session is building directly on this need. So our focus for today, we will be exploring how Africa's Knowledge Hub for AMR surveillance, which is powered by tools like ARA and GitHub, is enabling countries to standardize and automate AMR, AMC, or AMU data analysis, improve the reproducibility and quality of analysis, reduce the delays caused by manual data cleaning, as well as support evidence-based policy and resource allocation. Our speakers will also highlight how this initiative aligns with recent research published in the BMJ Public Health, which was a scoping review looking at global trends in inappropriate use of antibiotics from 2000 to 2021, which emphasized that national surveillance data often goes underused due to lack of analytical capacity and integration. It is my pleasure to introduce our expert panel from the African Society for Laboratory Medicine. In order of presentation today, it is my pleasure to first introduce Nkata Gitonga, a public health consultant at ASLM. She is a public health professional with a clinical pharmacy background and an extensive experience across public and private sectors. She combines clinical practice with strategic health systems strengthening, and provides technical expertise in pharmaceutical services, AMR-related surveillance, governance, policy, and capacity building across Africa. Our second presenter is Mr. Alan Abala. He's a monitoring and evaluation and data analytics specialist here at ASLM. He's a seasoned monitoring, evaluation, and data analytics specialist with extensive experience supporting health systems across Africa. Currently, at ASLM, Alan is supporting efforts to automate and scale data analysis and visualization processes for regional public health programs. He is contributing to the development of the ASLM AMR Knowledge Hub that we'll be showing today, applying his expertise in ARA programming, SQL, and DHIS to streamline AMR, AMC, and AMU data workflows. Our third and last presenter is Mr. Josiah Njeru, who is an AMR laboratory specialist and consultant at ASLM with over 10 years of experience in microbiology diagnostics, data management, and analysis. He has extensive experience in providing technical assistance to national disease programs in the African region towards efforts to build and sustain laboratory capacities for the detection and surveillance of AMR, especially looking at priority bacterial pathogens. Together, our presenters will walk us through how the GitHub-based automated ARA scripts can be used to support national and regional data analysis and reporting. I will now just highlight some few housekeeping aspects. This session will be 1 hour long and include a question and answer segment at the end. Please feel free to post your questions or comments in the Zoom chat at any time. And please note that there is simultaneous interpretation that is available in French and Portuguese. So please select your preferred language using the interpretation icon on your Zoom toolbar. So to kick us off, I'd like to welcome Nkata Gitonga to introduce the Knowledge Hub and what it means for simplifying AMR surveillance in Africa. Nkata, over to you.
Thank you so much, Sylvester, and good morning, good afternoon, everybody. Allow me to just share my screen. All right, please confirm that the screen is showing.
Yes, I can see your screen.
All right, thank you. So I'll just be taking us through introduction, and then I'll hand over to our other presenters to go through some of more detail. So we've already mentioned antimicrobial resistance, but for those who may not know what that means in entirety, it basically, in short, means that when bacteria, viruses, and fungi, or microbes in general, develop the ability to survive when life-saving medicines that were developed to treat them or kill them fail. So that's the context of what we're talking about. The development of antimicrobial resistance has now led to a call for action, coordinated action across countries and regions and the globe as a whole. Why this is really important for our region is that the data shows a grim picture for sub-Saharan Africa. In 2019, Sub-Saharan Africa experienced the highest rate of antimicrobial resistant burden, which was actually surpassing the deaths that were related to HIV, AIDS, or malaria. Also, in the context of low resource settings, antimicrobial resistance, though a global issue, really does impact low resource settings the most, which then face the greatest burden. So one of the first African content large-scale AMR surveillance exercises that was conducted was through the Mapping Antimicrobial Resistance and Antimicrobial Use Partnerships Phase 1 project. And some of the key highlights showed that only 1.3% of biological laboratories across 14 countries, African countries, actually did perform bacteriology testing. And of those that were conducting bacteriology testing, only 5 of the 15, which is 33% of the WHO priority pathogens, were consistently tested in most countries. So we're not meeting the target. There was some other some other key findings that were brought to light. One of that was that clinical and treatment data are not actually linked to laboratory results, hindering understanding what our antimicrobial drivers are. Also, on the use side of antimicrobials, only 4 antibiotics that accounted for approximately 67% of the total usage. So there's a skewed use towards only a few drugs, which can cause selective pressure on these antibiotics to then develop antimicrobial resistance. Stronger antibiotics or stronger medicines for resistant infections were also seen to be unavailable, which alluded to the fact that there was limited access to certain antibiotic groups. All these data points really does give the countries and the region some starting ground on what actions and policy directions need to be put in place to address this global threat. So as we know, our national action plans and the global action plan to prevent and contain antimicrobial resistance has a key strategic objective of surveillance. Recent findings, I think that was in TRACS 2023, showed that 97.8% of the responding countries in the African region do have action plans in place, which is a good place, starting point. But implementation and monitoring is definitely not optimal. So there were only, I think, about 71% of the plans that were actually receiving government approval. And as we know, surveillance strategic objective is a high resource implementation. It requires high implementation or resource intensive to implement that strategic objective. So government approval is one of the key strategies to ensure that surveillance is strengthened across the region. So I've mentioned MAP, which is the Mapping Antimicrobial Resistance and Use Partnership Project. So now in phase 2, the project is supporting 14 African countries. Those are listed on the left. And the main support is to improve AMR, AMU and AMC data quality, quantity, and analysis and dissemination for use. So AMR data for large-scale analysis is actually scarce in Africa. As I've mentioned, there were 14 African countries participating in MAP1 that gave some insights. However, the consistency of reporting and utilizing this data is scarce. So it does exist. However, the procedures of actually analyzing, reporting, and utilizing is not optimal. So I'll just quickly, just in broad terms, go through the process of how do we get this data that speaks to the decisions we make for prevention and containment of AMR. So at first, when you're looking at AMR, AMC, and AMU data, there is a process where we have to collate the data. And this is looking at all your data sources and being able to pull that data and make sure that it's representative of the country, that it covers all the key users. It then moves on to the data review process, which looks at cleaning and validating the process. Is the data complete? Is it accurate? Are we collecting the priority pathogens? Are we able to actually see these AST results and interpret them? Then we move to the data analysis section, where we use tools. We have standard tools like the Microsoft Excel that can produce analysis, WhoNet, Stata, and R scripts as mentioned. And then the reporting stage. So need to be looking at the data and pulling out some descriptive statistics, and then also looking at the resistant patterns. And when we're looking at antimicrobial use and consumption, we're looking at how our antibiotics are being used, which groups are the most utilized, and whether there is a correlation between the usage of antibiotics and the resistant patterns we are seeing. So the next 2 slides will just go through some of the key aspects we're looking at when we're looking at data. So on the left, we have data inputs, and this slide is looking at antimicrobial resistance. So in broad terms, we're looking at ensuring that data is available on patient demographics, clinical information, and microbiology data. The system inputs basically means with this data, what are we linking it to be able to then get some sort of output? So this looks at linking to WHO GLAS priority or those for the national priority list, linking, the isolate to whether it's multi-drug resistant, and what kind of system is being used to interpret the data. So then we get analysis outputs, and these are the basic ones that we're looking at is the proportion of resistant isolates, the AMR trends over time, resistant patterns based on your specimen types, location, age, gender, etc. So when we're looking at AMC and AMU, your data inputs are on the left again. So we look at the antimicrobial that we are surveying, and those are based on the core antimicrobials for surveillance that have been determined by WHO, and whatever else are the priority classes of drugs that the country have set in their surveillance strategies. There are other components around pack size, strength, the dosage form, so that you're able to really understand the utilization of this, of your antimicrobials. So again, system inputs, we're looking at linking these antimicrobials to the anatomical therapeutic classification. It's WHO DDD values, and link it to national or WHO aware categories. It's also really important to know the utilization based on essential medicine lists for the country, and those that are set out by the WHO. You also need population data so that you're able to standardize the consumption based on DIDs. So that's per population, per 100 inhabitants, 1,000 inhabitants. So your outputs, you'd be looking at DDD and DID indicators, and you're looking at either the total, which will allow you to see trends over the years, or seasonal to be able to see when you're utilizing antibiotics largely, to be able to see some seasonal variations. You also want to look at regional distribution and also by sector. Is the private sector utilizing more than the public or vice versa? And more disaggregated analysis points. Then you want to classify this as a breakdown on the class, the formulation, the aware, and the EML status, so that you're able to just make sense of your use of antimicrobials in the country. But to be able to collate all this data, over the years, there's some gaps and challenges that have been highlighted. One of those is the lack of standardization of data collection tools. There's limited epidemiological variables collected alongside the surveillance data. So there's gaps in our data that we're collecting. Undefined surveillance priorities at a national level. So although there's a lot of guidance out there from WHO, even from the region, African Union, CDC, ASLM, even the regional communities, the countries still need to set their priorities to be able to ensure there's consistency and uniformity across the country on what we're collecting. The frequency of data review analysis is limited to annual in many countries, or periodic even by more than annually in some countries. The whole process has been reported to be time-consuming, resource-intensive, particularly when you're looking at the data cleaning process, because these are large data sets. So when we specifically look at challenges with data processing, analysis, and reporting, I think the main issue that we're trying to address here is that we have fragmented data. We also have a high utilization of just manual analysis. And as mentioned in the previous slide, that is both time and resource consuming. And there's also been reported some lack of technical capacity to be able to see this process through to reporting. So that brings us to why we're here and why we want to look at automation as one of the strategies to ensure that we are analyzing data for decision making. So I'll hand back over to you, Sylvester. Thank you.
Sure. Thank you very much, Gata, for providing an overview of the challenges that we are facing as a continent. In the chats, I've also tried to share for those that are not familiar with the Mapping AMR and AMU partnership, the MAP project, that is one of the regional grants that ASLM has been implementing under the Fleming Fund grants. The country reports that came out of this have been shared. The link to that has been shared. And there's also, based on what Nkata was highlighting in terms of, the key indicators for AMR, for AMC, for AMU, that you can access more information about that on the guidance document. That is also something that came out of the MAP project. So with that said, once again, thank you, Kata, for providing just the overview of the challenges. So now we will now move on to our next presenter, Alan, who will then take us through the opportunities that are now presented by these challenges and how the AMR Knowledge Hub is coming in to try and address these challenges. Alan, over to you.
Thank you so much, Sylvester. Perfect. And thanks again, Dr. Nkata, for setting the stage and highlighting the challenges that are currently being faced. And like you rightly mentioned, this brings us to the major opportunity, which is automation. We know automation offers us the ability to process and analyze data faster in a standardized way and at scale. We know it's a necessity for effective surveillance of systems that can adapt quickly to real-time changes. Automating AMR, AMC, AMU surveillance systems is critical. We believe it will support our real-time trend monitoring, minimizing human error, and improving data accuracy and comparability. It enables timely evidence-based decisions and aligns with regional and global data sharing frameworks. And most importantly, it reduces manual workloads and frees up time for higher level interpretation and action. To help address these challenges, some of these challenges, SLM has established a knowledge management hub that will include the AMR Knowledge Hub, which is currently under development. This platform will support data analysis. It will promote collaboration and empower users from policymakers, researchers, with tools and frameworks for evidence-based decision-making across the region, across Africa. The hub will provide user-friendly analytical tools like a pre-built R scripts and visualizations, which will be hosted on GitHub. We'll see that momentarily. It will feature guided workflows that will walk users through data analysis. And one ambitious feature that we will want to add to this AMR Knowledge Hub is AI-driven alerts that will flag emerging resistance patterns. And also lastly, it will include tutorials and case studies to support users in low-income settings. Most of the materials and resources have already been gathered and will be uploaded and launched within this part of the SLM Knowledge Management Hub. So how are we going to achieve this automation? R and GitHub are core to this automation strategy. R enables powerful script-based analysis, while GitHub serves as a central repository for collaboration. For updates, for knowledge sharing. Together, we believe these two will be the backbone of scalable and producible AMR data analysis. R especially is very valuable because of its reproducibility and versatility. From data cleaning to visualization, every step can be standardized across the board. It allows automation and version control through scripting, making the processes faster and consistent. It's open source, widely used, and flexible enough to meet diverse country needs. GitHub will complement R by offering a secure collaborative space to store and share scripts and documentation, which is really key. It will support team workflows, access control, and encryption, which is very key for security of data and privacy. It is actually a living knowledge hub of in itself, where updates, feedback, and contributions can be managed transparently and efficiently. To use these tools, you need a basic setup, very, very basic, a computer with internet access, software, specifically R Studio, and GitHub Desktop, all of which are free. These basically will ensure that tools remain accessible and adaptable to varied local contexts. Here is how the pipeline will work, just briefly. You'll input clean data in an Excel or CSV file format, run pre-coded scripts, no advanced skills required, as you'll see, and automatically generate structured outputs. These will include metadata tables, antibiograms, trend graphs, and resistance summaries by demographics and specimen types. So we have already published pre-built R scripts in GitHub, organized in sets A, B, and C, each serving a different aspect of AMR, AMC, and AMU. And these scripts will simplify cleaning, analysis, and visualizations using standard indicators like the DDDs and resistance patterns. So let's dive into a short demo that we have developed for you.
Apologies.
You will have access to the folder. Launch the GitHub repository by following this link and then signing in to GitHub with your account. You'll access the GitHub once it has been shared with you. You'll have access to the folders and then the README file, which is the most important thing for users. This is where you'll find instructions and step-by-step guidance on how to utilize the scripts that have been developed. It is divided into 3 sections. The first one is called Set A, that focuses on AMR. The second one is Set B, that focuses on AMC. And lastly, the third one is called Set C, that focuses on AMU, which is currently under development. So we'll demonstrate how to utilize the scripts with Set A. The first thing to do is to make sure you install the right software. You'll set up the environment. The first thing to do is install R. Second one is to install R Studio, and lastly, the third is to make sure you install GitHub Desktop. There are links in the documentation on where to find and install and download the required softwares. So once you're done with setting them up, you'll clone this repository on your computers, from which you'll be able to utilize what is here from your computers, and also from where you'll be able to actually copy and paste your datasets on your side. Yes, so the first thing to do is launch GitHub Desktop. As per the instructions, you are going to copy the URL for the repository, bring it into your GitHub Desktop, and then make sure you click clone a repository from the internet, and then you click on URL, paste it in that provision, and then make sure you choose the path where the GitHub will be cloned. In this case, it by default will always select documents, but you are free to choose where you want it to be stored. Once you've selected where you want it to be stored, you will clone it. It takes about 2 minutes or less. And once it's done, it will fetch the dependencies and store them on your computer. It will pick them from the GitHub online and store them on your computer. So when you go to documents, you will notice that it has now created a folder here called GitHub, and within that folder, a folder for the repository will be created. So the folders that are within the virtual, the online version, are now also cloned on your side on your computer. So how do you utilize the scripts now going forward? The next thing to do is make sure you launch R Studio as guided by the documentation. You'll go to R Studio and then navigate to where you've stored the repository. Let me do that. You click R Studio, go to File, New Project, go to Existing Project, and then browse to where that directory is, and in this case it is in Documents, and then Map Data Analysis Repository. You open it and then you create a session. The next thing to do, as guided by the documentation, is to actually open up an R script file. Again, you go back to R Studio, File, New File, R script. The next thing to do is make sure you have the right data and copied and pasted into a test data folder as guided by the documentation. So if you're doing this for the first time, you'll go to your repository on your computer, get your data set and paste it in this folder called test data. The data set should be named specifically AMR data set using that prefix, and the structure of the data set will be provided as part of the SOPs for the GitHub repository so that you're able to know exactly what variables are supposed to be there and how to actually name the variables. So once you have that data in that folder, you'll run follow steps 1 to 4. The first one is looking at, the first one actually is about loading packages. So you'll just copy this command. It will, you'll bring that command and paste it within this space in RStudio. You'll click run. That command will install all the necessary packages within RStudio that you'll need. The next command is to provide the pathogens of interest. This is where you'll enter the specific organisms of interest as per your dataset. By default, we've only listed escape pathogens here. You'll bring that command, paste it here as well, and then run it. It will create a vector file. The third one is to specify your country code. So depending on the country dataset you're using, you will indicate the country code. A list of the country codes will also be provided along with the SOP. You run that. And then finally, you run the main script, analysis script, which will perform an end-to-end analysis. So you copy that and then run that. So it usually takes about 10 to 15 minutes, depending on the size of your data. However, once it's done running, it will create 3 outputs. The first one are basically tables based on your input file that are on demographics, facility information, generic organism lists, and a test result file with cleaned and standardized AST interpretations. The second one is an antibiogram of the test bug drug combination, and the third one is subfolders of analyzed pathogens with each folder named after the organism that has been analyzed. So within those folders, you'll have CSV files of resistance distribution by age, gender, and specimen, and then bar plots. So I'd already run this earlier, so you'll go to your documents where the repository is saved, go to results, and each time you run the scripts, the outputs are actually stored. As you can see, the subfolders are here for each of the organisms analyzed, and within those folders you'll see the resistance distribution by the age, gender, and then specimens, and as well as bar plots. For example, if I click on this specific organism, you'll see tables that can be put in PowerPoint presentations and reports, as well as bar plots that can be utilized for the same purpose. That is it briefly on how the scripts can be utilized for analysis without actually having any technical knowledge in and how to write scripts. It basically makes the whole process of cleaning and analysis really efficient for users. Thank you so much. Thank you, and over to you, Sylvester.
Great. Thank you so much, Alan, for that presentation, and thank you so much for taking us through the aspects of the GitHub. And I can see from the comments that there is a lot of question and interest around this. However, I'd like to thank you, Alan, again for giving us that overview of the AMR Knowledge Hub. And it's good to see that we are actually using, automated ARA scripts, using ARA software, which is freely available and does not have annual fees attached to it. And that this is housed in the GitHub, which is a platform for collaboration. So now that we have an idea of what GitHub has and the opportunities that it offers, we'll now move on to our next presenter, Josiah, who will provide an overview of the next steps in terms of what we intend to do with this. Josiah, over to you, please.
Thank you so much, Sylvester and Alan, for taking us through the demo. So I'm going to bring all this to perspective and probably mention a few things that ASLM is doing. From what you've seen from the demo, this hub is going to revolutionize how we've been doing our data cleaning and analysis, and reap a lot of benefits in terms of achieving accuracy and reproducibility, very standardized analysis outputs, and good visualizations. I saw Alan take us through a few of them. And we are able to, without taking a lot of time, be able to generate quality improvement actions for our national AMR, AMU, AMC surveillance systems. So you've seen within approximately around 20 to 30 minutes, you're able to have your outputs, unlike where you're doing a totally manual workflow that can take even a week before you have good outputs. One time we had a session in one of the countries we are working in, and I asked participants in that workshop whether they liked the entire process and if it's something they would want to do it again. And it was a big no. So automation is going to make our work very easy. ASLM will be happy to convene on-demand technical support sessions with countries. The demo was brief, so we can have detailed technical support sessions with countries so that we take you through step-by-step bits of how to actualize use of this hub. So two of success factors in terms of adoption of this automated workflow. What we've done as ASLM, we are encouraging countries to constitute multidisciplinary teams to support data management, data analysis at the national level. And we've developed terms of reference for such teams. And of course, this is in the spirit of sustainability. So these teams will work with ASLM technical experts to walk you through the entire process so that even after projects like MAP and other projects that are running within countries, once they close, these technical capacities are sustained. ASLM, one of them, it's envisioned from MAP, we are going to create a regional repository to contribute to regional surveillance efforts. So we're looking forward to countries being willing to share their national surveillance data so that it can inform AMR containment interventions at the regional level. And of course, there will be data sharing increments with each of the countries. In terms of next steps, as Alan has demonstrated to us, the repo for AMR data cleaning and analysis is ready to use. So countries will be getting access to this. And what we are working on are scripts for AMC, data cleaning and analysis. Currently they are at review and validation step. And then once that is done, we'll proceed to look at the scripts for AMU, which comes with a little bit more of a lot more variables compared to the other two data sets. We're also looking forward to be able to create country-specific repos, simply because there can be a bit of variations in terms of data structure from one country to another, a bit more expanded priorities from what are the priorities spelled out by WHO GLASS 2.0. And we'll be happy to receive feedback from countries after you adopt this automated workflow. We'll be very happy to hear some of the areas you'd want the workflow be improved. Of course, all the steps that you've seen are informed by lessons that we've collected from across the countries, but there are rooms for improvement to these workflows. And we're looking forward to be able to formally launch this AMR Knowledge Hub as a resource to support AMR, EMU, EMC surveillance efforts across the African region. Thank you, and over to you, Sylvester.
Thank you very much, Josiah, for that. Really, I would like to take this opportunity to thank you very much, Nkata, Josiah, and Alan, for your fantastic presentation. I think your presentation has really provided a good overview of the Africa's Knowledge Hub that we are trying to put together as ASLM, and also to highlight how open source tools like ARA software and collaborative platforms like GitHub can really help to transform the landscape of AMR surveillance in terms of automating data analysis and also improving, hopefully, in the long run, reporting across the continent. So you've demonstrated how automation and these collaborative tools can simplify AMR, AMC, and MU data analysis process, and also potentially empower the national programs that are dealing with AMR surveillance to then be able to produce some reports that will also contribute to them making informed and evidence-based decision. This is really something that's going to be really helpful going into the future, and not only in terms of saving lives, because we need this information to make informed decisions, but also going towards strengthening aspects of data integrity, aspects of comparability across countries, as well as also accessibility, because we want to make sure that these tools are accessible as much as possible. And I like that you've mentioned that, thinking beyond these projects, we want to make sure that these tools remain available to countries and labs or institutions that may need this. So all of this is very crucial in terms of driving action at both the local and regional levels, really. So we have received some excellent questions and comments in the chat. I can see that my colleagues are also helping to answer some of these questions. So I also would like to acknowledge, I see some colleagues also just giving some general greetings. It's nice to meet all of you, and thank you for joining us. So we will then maybe, I'm just going to try and check if there are like a few comments that are there, and then move on to some questions. So I think there was one question that I saw that was asking for the GitHub link. So this has been answered by my colleagues, Alan, who has indicated that, we will be sharing. So currently, right now, we were just finalizing a few things in terms of the development of the software, but then we will be sharing this as soon as it is made public. There's a question from Roderick, which I think for the benefit of others. He says, are there any aspects of the ASLM programs that assist lab personnel with data collection and analysis as far as AMR data is concerned, to reduce the data-related challenges presented by Dr. Nkata, especially in the private sector? So this is really nice to see that we are having private sectors also coming in. I did make a note that, looking at the MAP project, we actually saw that 50% of the data that was analyzed under MAP actually came from the private sector. So we really encourage the private sector to also get involved and also contribute this data, because without that information, we have limited insights. So I will highlight our project lead's Anapi, who has responded and said, yeah, initial support ideally was via the country focal teams, where these tools and routine flow, including also from the private sector. So these projects are through the country focal teams, also including the private sector. So we hope that we will continue to engage. So I can see the response there. Just going to try and see if there's any other question. Yes, Alan, maybe for the benefit of everyone, if you can come back again, there's a question here that was asked by Wesonga Wanjala Peter, who was asking, can we incorporate AI and ARA? Is AI threatening to ARA? How do you find this? So please, Alan, over to you.
Thank you. Thank you for that question. Yes, it's possible to incorporate AI and R, and these are normally done within repositories like GitLab, GitHub. I already mentioned that to that answer to the question within, I think, the chat that currently GitHub is already incorporated with Copilot. So as people are collaborating within this space, within this repository, they are able to utilize this AI that can actually help with even the scripting itself. So you're able to make everything more efficient and faster in that way. So yes, it's possible. And currently we already have our repository that is incorporated with Copilot in GitHub. Thank you. So in regards to whether it's a threat, I wouldn't really see it as a threat in a sense that AI can really support, improve the scripts that we develop, the pipelines that we'll develop, which is actually a benefit for everyone. Thank you.
Great. Thank you so much, Alan. Then maybe just a question, we've shared this, maybe a question to Josiah. I think on your slide, in terms of the next steps, you mentioned some key aspects. Would you like to maybe highlight some key aspects of maybe the terms of reference, so that maybe for those countries that maybe are not part of the current Fleming Fund priority countries, what are some of the key things they need to already think about when putting up a team that we can then support in terms of capacitating in the use of this tool and these resources? Over to you, Josiah.
Thank you so much, Sylvester. And I see in the chat there is a question like that came, like training some interested personnel on required AMR data analysis can reduce those discrepancies. So, and that's why ASLM has gone ahead to have TORs for teams that can support data analysis at the national level. So, and we're looking at the entire workflow from collection, because again, you don't want to get data that that is not of good quality coming to the national level for analysis. So that again would not be prudent use of resources. So in terms of team constitution, and this is not prescriptive, we are looking at countries having teams that include microbiologists, so that at least microbiologists, pharmacists, they handle the technical aspects of AMR, AMU, AMC data, epidemiologists to support with interpretation. We realize again one gap across our region. Yes, we might be doing a lot of analysis, but we are not taking time to interpret what this data means in terms of our AMR mitigation actions. We're also looking for data analysis specialists. These are statisticians, biostatisticians that do the proper data analysis. They have data analysis skills. And in terms of TOLs, they would be supporting national coordinating bodies on issues of data cleaning, data analysis, reports generation, supporting capacity building efforts at the national and subnational level, and fostering data integration efforts. In the course of our work, we've realized that as much as countries are not at the same level in terms of whether AMR, AMC, AMU surveillance, those systems are completely disaggregated. And as a continent, we need to get to the point where we look at our AMR trends side by side with our consumption trends for better interpretation of what we are seeing across. And of course, fostering collaborations. In terms of the deliverables, these are the guys who will be helping countries generate reports, generate quality improvement plans for the national surveillance systems, and also doing reports. I think in terms of TOLs, that's the much I can mention. Sylvester, in case I missed something, probably you can add, and I think these TOLs will be shared widely beyond the countries that the project is supporting. Over.
Thank you very much, Josiah. Yes, indeed. Also as part, I think there have been questions asking about the presentation, about the video. So we usually share these at the end of the webinar. So the video recording, the presentation and the results, the terms of reference that Josiah has just mentioned will also be available on the ASLM website, so that for countries who are not part of the Fleming Fund projects, you can already access the terms of reference and get an idea of what kind of team members you need to put together. And then you can feel free to reach out to ASLM and we can see how best we can support. So thanks again for that, Josiah. Thanks again, Roderick, for that question. Hopefully that has helped you in terms of what we are trying to do as ASLM to build that capacity to use even these simple tools. There's a good question that has been asked. Thank you, Dr. Christine from Kenya. She asked, so wonderful presentation to all. Is GitHub applicable for other AMR, AMU, AMC dataset apart from the ones from Human Health? There was another similar question that was talking about One Health. So I don't know whether Dr. Nkata, you might want to take that just to highlight what kind of data sets. Are we only looking at Human Health? Or over to you, Dr. Nkata.
Thank you so much, Sylvester. I think when we just talk about AMR, I think the universal thinking is that we cannot contain AMR if we look at only one sector, because the health of one will affect the other, as we know. So I think this is a starting ground at the initial development of this script, looking at the data inputs or the system inputs that we've put into place. They are skewed towards human health. However, this is a starting ground, and it's not a finished product. As Josiah had mentioned, we are hoping that even the inputs from countries, as these systems are tested and utilized to be able to produce these reports, can be fed back to ASLM to ensure that we build this. So when looking at the One Health aspect, they are just slightly different system inputs that need to be put in place. Even when you're looking at antimicrobial consumption, we're looking at DDD vets as opposed to just DDD for antibiotics in human use. So there are system updates that would have to be put in place, but the whole thinking is that at the end of this ongoing process, the Hub will be able to, support the AMR containment effort in terms of surveillance in the entirety of the One Health approach. So I think that is the ultimate long-term vision. So we should not be upset to hear that this is looks a bit human health focused at the moment.
Great. Thank you so much, Dr. Nkata. Yes, for sure, we are using a One Health approach. So, we sometimes you need to take things step by step. So we might have started with the One Health, with the human health side, but obviously the goal is to also use the One Health approach ultimately. There was a good question that has already been answered in the chats from David Maina, who says, thank you for the great presentation. My question is, after generation of this data, does the team share or disseminate the findings to the relevant stakeholders and help in advising maybe the relevant drugs that is high resistance and is still being used in the market? Thanks. So glad to see that there's a response there, but just sharing it for the benefit of others that yes, the reason why this AMR Knowledge Hub has been put in place now is to actually facilitate exactly what David has shared there. We don't want countries to just, collect data, analyze it, and then it stays on someone's desktop or nothing is done. We want that to be used by countries to also inform. So if we can use such automated methods to speed up the generation of such reports, that is the goal, really. Then there was a technical question. Alan, I'll just get back to you quickly. So there was a question from Wanangwan Ndovi, who says, is it possible to create one config file for some of the parameters of the script rather than pasting them one at a time in the other console? And I think with this also, I think, Alan, we mentioned that, for countries that are worried about, yeah, please maybe answer this question and then I'll come through.
Yeah,
I hope
Yeah, thank you. I was actually going to point it out before closing. That's actually a very great question. And it's why we are encouraging collaboration within the repository. It's absolutely possible and highly recommended to create a configuration file. I don't know if you noticed, I think you, of course, obviously noticed we have about 3 commands. So what they are requesting for or trying to check is if we are able to create one file that someone will just run and it will do all those 4 steps that we had that I had highlighted. So it's really possible, and it's something that we are planning to do as part of the cleaning up process, so that we make the repository public for everyone to access. And thank you for that contribution. We welcome all such contributions to help improve the tools that we've built. Thank you.
Perfect. Thank you so much, Alan. And definitely that is why also I think the GitHub platform has been created, because we are also able to then get such collaborations coming through and some good inputs to continuously improve this platform. Also, I just wanted to also just highlight, I think, there are some countries that have reached out to say, we are already in the pipeline of creating something for the country and, data sharing issues. So just wanted to also put it out there that for countries that are interested in this, but we're already working on something, for us through this Knowledge Hub, really, it is possible to just clone this GitHub and then incorporate it into your own in-country server. The goal really here is that we have created these tools. We want countries to access them and to help them improve and generate more reports in country, as well as share them across the region for the benefit of collaborations as well. So I will just say, due to time considerations, would like to take this opportunity to really thank everyone who shared the questions and comments. At this point, I would like to really invite our presenters to share any brief closing remarks before we wrap up. So please, maybe in the same order of presentation, Dr. Nkata, Alan, and then Josiah, any closing remarks, please, from you?
Okay, just thank you so much for this engagement. It's good to see so many people interacting in all the questions that are here. I just really employ everyone to make the steps to really contribute to AMR containment, even through these surveillance initiatives, and just treat it like a relay. I've seen a lot of questions around the utilization And once we have the data, it will speak to something that will be able to move the country forward towards containing AMR. So thank you so much for your engagement, and we're looking forward to ongoing collaboration.
Great. Thank you so much. Over to you, Alan.
Thank you, Sylvester. Thank you, everyone, for joining and for the active engagement and contributions. We are definitely going to make sure we respond to all. We've picked up a few that we are going to actually incorporate and improve. We are currently cleaning up the documentation, and we'll be working really fast to make sure this is public and accessible for everyone, so that the contributions and collaborations can actually come in and start to help improve how analysis is done, and also help improve the scourge of AMR. Thank you.
Thank you very much, Alan. And then lastly, but not least, please, Josiah, over to you.
Thank you, Sylvester, and to all the participants. So mine is to encourage countries to consider adopting this automated workflow. Let's reap the benefits of this automation. We reduce the time we've been spending on cleaning and analysis, and that means we'll have more time focusing on interpreting our data for decisions. We will be on the lookout for lessons coming from the countries so that you can keep making this AMR Knowledge Hub stronger each day. Thank you.
Thank you very much, Josiah, and thank you to all the presenters once again, Dr. Nkata, Josiah, and Alan. Please, before you close, please note that you will be receiving an email, as mentioned, that will give you the link to download this presentation, to also access the presentation itself, as well as also to get your certificates for attending this session. So if you've also not yet registered to become a member of ASLM, we encourage you to do so using a link that we will share through the emails as well. And this will just help you ensure that you stay updated and continue to access valuable resources via the ASLM Academy. So we hope that you will continue to engage with us, and we really appreciate you coming through. So it has really been a valuable session, and as always, we are always looking for ways to grow our collective knowledge. So stay tuned for more upcoming AMR CoP webinars on critical topics related to AMR surveillance. Otherwise, wishing you all a great day and a weekend ahead. Until next time, it's goodbye for now. Thank you.